earlier it was ready to play, and when I started off, it was any general practitioner who could assess the based on the height, weight, chest circumference during inspiration, expiration, basic systemic examination, and the vision, and say a child was fit to play in school or participate as a guide. But now, with such case scenarios, it's an elaborate pre-participation assessment. So why? It is not just to exclude an adolescent from participation, but to ensure the safe engagement in physical activity, optimize performance, and identify medical conditions that may require monitoring or modification of training. And this ideally should be done about 6 to 8 weeks before the season, so that we can take some corrective steps too if necessary. Most importantly, this is one opportunity. We all keep telling we don't see adolescents, we can't do anticipatory guidance. So this would be an opportunity to do that. So the objectives of the assessment is to detect conditions that predispose to injury or sudden cardiac events, which we see quite commonly in many of the games that are being played, and assess growth, development, readiness for sport, preventive health counseling, match the athlete with the sport best suited for her or him, and issue a clearance or limited participation or a restricted certificate till further evaluation. So amongst these, if we go into our heads, we will cover almost 75% of it. So most of the previous illness on drugs, drugs for any illness, such things would be forthcoming. But perhaps we need to ask for the family history of sudden death or disability in young age in the family, and what would not be forthcoming through our heads. So the diet, fads, and now supplements, that is separately they will be speaking on. The health risk behaviors, again, apart from the drugs and sexual practices, the pathological weight control measures that the child or adolescent is taking. Immunization, yes. What are the catch-up immunizations to be done? And also advised about what are all the vaccines that are being given in this age. Mental health, again, will be covered. And we must not forget a recent febrile illness. Physical examination, again, the routine. But here, one thing is BMI. We all talk about BMI, whether the height and weight. Like I said earlier, we were only measuring the height and weight. But the SMR staging is also important, because BMI correlating with the SMI stage is important. And apart from the cardiac, respiratory and all, musculoskeletal is a system which we do not pay too much importance when we do our general physical examination. So this should be paid attention to. And skin, especially in contact sports, because if there's any infectious lesions or something, they need to be told about it when they are playing with contact. So investigations, not routinely recommended, only on suspicion, ECG or echo or spirometry, generally the asthmatic adolescents, imaging specific. So avoid indiscriminate investigations. The red flags, cardiac and neurological, we need to do, orthopedic and medical, severe eating disorders and infections which have been recently done. So counseling and preventive guidance, hydration, because water, most often, all of us also forget about water. So that, and especially in previous heat-related illness, balanced nutrition, safe progression of training intensity, again she'll be talking about later. Importance of reporting symptoms promptly. So even something which they think insignificant, we need to probe and ask. Injury prevention, use of protective gear, vaccinations, a big no to drugs, just to gain whatever it is, muscle or the mindset. And encourage enjoyment, teamwork, long-term health focus. So this would be an important thing. Yes. So the practical challenges, all said and done, we wouldn't have so much time. And especially when people come with a mass clearance, like say for NCC or some sport event, limited access to sport physicians. Like, okay, we are all in major cities, in smaller places, but still people are wanting to play. So we must adapt to local resources. Also, we must have contact with some people whom we can contact when we have doubts, especially because we are certifying and we need to be sure about it. Athletes, the other thing is the pressure. See, the competition, like this child also, when she wants to go. So if we say, no, you cannot go a restricted clearance or something like that, they may think of it otherwise. So, balancing all this are the challenges. So, so, to conclude, sports, we all have been talking about how much recreation, exercise, all that is so important. And our role is to ensure the energy is harnessed safely and sustainably. And this PPE let us transform from clearance to a tool for adolescent health promotion.
Thank you. Thank you, madam.